Hi, I'm Susan Taylor with Scripps Health in San Diego, California. According to the American Cancer Society, lung cancer is the leading cause of cancer death in the United States. Early diagnosis is key to a better survival rate. Fortunately, there is some terrific technology that is able to catch lung cancer in its earliest stages. Joining us to talk about this is Dr. Samir Makani. He is the Director of Interventional Pulmonary Medicine at Scripps Memorial Hospital Encinitas, and he is the Director of the Lung Cancer Screening Program for the Scripps Cancer Center. Dr. Makani, thanks so much for being with us.
Hi, Susan. Thank you for having me.
So what causes lung cancer?
The primary cause of lung cancer is still smoking related. 90% of cancers, particularly lung cancer, are related to smoking.
And who's most at risk?
As we age, our risk increases because of other factors, but primarily those who have smoked for a significant amount of time have higher risk of lung cancer.
And what are the symptoms?
Lung cancer, unfortunately, usually presents late, but symptoms can include cough, shortness of breath, even coughing up blood are potential symptoms you may experience.
But there's lots of things that could make you cough, right?
Absolutely true, especially during the wintertime months. We get a common cold that leads to a cough and even a lingering cough. But if you have risk factors, that are active or prior smoker, or you have family history, and you have a cough that's lingering on, it's important to get that checked out.
So according to the American Cancer Society, early diagnosis is key to survival. Talk about the survival rate.
That's absolutely correct. So as we know, if we find lung cancer in late stages, survival at 5 years can be in the single digits, as opposed to when we find it earlier, stage one, survival rates can be as high as 80% or even higher depending on the type of lung cancer it is.
So Scripps has a very comprehensive lung cancer screening program. What does that entail?
About a year ago, we developed a fully comprehensive lung cancer screening program involving lung doctors, radiologists, cancer doctors, who all came together, and we developed our program here at Scripps Cancer Center. And what that entails is three components. One, what we call a shared decision-making visit. So if you're between the ages of 50 and 80, you've smoked for a long time, at least 20 pack years, and have not quit within the last 15 years, you qualify. You'd have a one-on-one visit with our nurse practitioner. She would go over what the risks and benefits of lung cancer screening are, help you quit smoking if you're continuing to smoke still, and lastly, talk about other things like emphysema and COPD. Once she's completed her visit, you would undergo a CAT scan, which just takes a few minutes. The radiation risk is extremely low. And then she would meet up with you once again after the scan is complete to go over the findings. The majority of those findings are normal, but on occasion we do find something that needs to be evaluated further. And that's what we're trying to accomplish, just find these early lung cancers so that we can diagnose them much sooner.
There are also folks, though, who get lung cancer who have never smoked.
That is correct. Currently the lung cancer, as I had mentioned, is 90% related to smoking, and the majority of those are related to that. And there's still about a 15% risk of smoking here in the United States that people do smoke. But as we see smoking rates come down, we are seeing other reasons for people still to get lung cancer. And some of that is genetic predisposition, some of that's family history. We don't have all the answers to that currently, but there definitely are patients who develop cancer without a smoking history.
Talk about secondhand smoke.
Secondhand smoke is important. We still don't know the exact mechanisms or the exact contribution, but for sure, we do know that smoking is not good either firsthand or secondhand.
What are lung nodules and what causes them?
Lung nodules are little spots in the lung that we can see in the lung tissue. So anywhere in this region here or in this region here in the lung, they are usually smaller in size, but they can be found either on a chest X-ray or a CAT scan. And these can be anything from an inflammatory thing, so some type of infection in the lung or some irritation in the lung, but they can also be early lung cancers as well.
And talk about this innovative technology that's allowing us to diagnose lung cancer in its earliest stage. What is this robotic bronchoscopy?
When we try to find one of these nodules that we had talked about in the lung tissue here, you can see in the areas here on both sides, there's multiple branch points. And it's almost looking like a tree in wintertime with all the different branches. And so when we're talking about doing a biopsy of these small little, potentially centimeter or slightly bigger nodules, we used to sometimes put a needle from the outside of the chest. Sometimes, we can talk about doing surgery. But now with bronchoscopy and using robotics, we can go through the main mouth here without doing any cutting on the inside and come down from the inside and navigate through these tunnels here to get to the location that we want to with less risk and less complication.
And is this painful? Are you sedated for this procedure?
The procedure is done under anesthesia, so you're completely asleep and comfortable. And it takes about an hour and a half to an hour, and then you wake up and go to recovery and go home. It's an outpatient procedure.
And why is it so much better?
The procedure itself over the years has evolved. Back when bronchoscopy first started, we had limited access to the chest from the inside. And now with robotic bronchoscopy, we're able to reach the smaller lesions in very difficult portions of the lung that were unattainable from biopsies from the outside, what we call a CT guided biopsy.
And it's this what sub-millimeter accuracy? What is how accurate is that?
We try to get close to these spots that we're talking about that are sized potentially of an eraser head on a pencil. And so with these lesions being so small, accuracy is extremely important.
And the computer bronchoscopy, it allows you to go into places where you were not able to go before. Is that correct?
That's correct. It allows us to reach areas where we couldn't reach, but also provides stability. So when we get to where we want to go, that we're able to maintain that position and get successful biopsies.
So if you are diagnosed with lung cancer, how is it treated?
There's three main avenues for treatment. One is surgery, the second is chemotherapy, and the third is radiation. For most early stage lung cancers, if we're fit as an individual, we can cut it out. And so that doesn't mean cutting out the whole lung. What we try to do, assuming that the lung cancer will say it's up in this area, we would try to either cut out just a portion of the upper part of the lung, we call a lobe. And in certain occasions, we can do something called a segment or a portion of that upper lobe where we can spare the majority of the lung. The goal is to get all the cancer out in a minimally invasive fashion. Here at Scripps Cancer Center, we also perform robotic cancer surgery as well. So besides getting bronchoscopy or diagnosis robotically, we can also get your surgery performed robotically as well.
If you do have to cut out a small part of the lung, does that affect your breathing in any way?
In the majority of cases, no. So we try to limit the amount of lung being removed, but at the same time, we do testing before the surgery to make sure that you have adequate, what we call lung reserve, that if we do remove a portion with the cancer in it, that you're going to be just fine and be able to still participate in all the things you love to do.
If you have lung issues, when should you go see a doctor?
The most important thing is if you have a lingering cough or shortness of breath, I think it's important to get that checked out, especially if it's lingering on and it's just not something that's going away or getting better.
When you say lingering on, for how long a period of time?
I'd say over weeks to months. If there's no inciting thing, like you didn't have an infection recently, and just you're noticing that you're just not feeling well, or this is cough that lingering on with no thing that's added to it from before, it's definitely important to get it checked out.
Any final thoughts, doctor?
First and foremost, I think if you're actively smoking, we should try to stop for sure. Second, if you're having symptoms of cough or shortness of breath that are lingering on, definitely feel free to get that checked out with your primary care doctor for further evaluation. And thirdly, most important again, is if you qualify for lung cancer screening, it's very important to get screened. We know for sure that early diagnosis of lung cancer through lung cancer screening provides a higher survival rate at 5 years. Here at Scripps Cancer Center, we're actively looking at ways to improve our screening techniques. We're looking at different blood tests to help us identify high-risk patients as well. So there's a lot of innovative things happening in and around screening, and I think it's important if you qualify that you definitely talk with your primary care physician about getting screened.
Dr. Makani, thanks so much for taking the time to be with us. We appreciate it.
Thank you, Susan.
If you want more information on how to screen for, diagnose, and treat lung cancer in its earliest stages, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.